The Arua City local government leaders and the in-charges from the different health facilities commissioned an assortment of medical equipment worth shillings 149 million for the health centers at Arua Hill local government headquarters in Arua City. The principal medical officer, Dr. Pontius Apangu, stated that this procurement of the medical equipment is to ensure efficient delivery of health services and cautions the medical in-charges to ensure effective use and safe storage of these equipments.
I want to thank the government of Uganda and especially the Ministry of Health for ensuring that we're able to have this equipment. Otherwise, the situation of equipment in the health facilities is not good. We consider the procurement of medical equipment as part of the key components requirements for efficient and effective health service delivery, hoping to have good health outcomes for the people. Town Clerk, you headed the technical planning and budgeting. Thank you so much for enabling us to go through that time. And the council, thank you so much for approving the budget to procure medical equipment. These are equipments that were procured out of last financial year's budget. We procured assorted equipments worth 149 million shillings. These equipments were eventually delivered. There was some delay to do this commissioning and ultimate delivery of these equipment to the health units because we needed to engrave the equipment first. When we are able to engrave the equipment, about 4 or 5 equipments were not engraved because the engraving machine broke down. These were mainly the refrigerators, the neonatal intensive care unit equipment, but the rest were engraved. I am grateful for your coming and for your endeavor to commission these equipment.
The Deputy Town Clerk, Arua City, thanks the Government of the Republic of Uganda for this procurement and stated that the local government is to recruit capable staff to ensure proper use of their equipment.
I am happy because it has taken us quite some time to have this equipment procured. The simple reason being these are specialized equipment that we can't just get from the open market. So the procurement took long. We had a lot of battles with the auditors. Actually, the delayed procurement of these equipment became an audit issue until we had to convince the auditors that these are specialized equipment that you can't just walk the market and buy. They have to be ascertained in terms of the quality, the standards, all have to be ensured. That's why today I'm glad that finally we have received them. And we continue to thank the government of Uganda for giving the necessary funding to have this equipment procured. The city is undergoing validation exercise. I want to assure you that we shall have the necessary staff in place to make sure all these equipment are used. Even if now we don't have them in the meantime, but sometime before the end of this month, we shall advertise and recruit all the necessary staff. And part, actually, priority on our list of recruitment is health, because they are dealing with human life. So the in-charges don't get worried that maybe when we take one equipment there, somebody, we don't have the staff to operate it. We shall avail that staff so that we make full use of this equipment. But I also want to urge you, since these equipment were procured using government funds, the quarterly government funds that are sent to you, you plan for operation and maintenance. Don't think that doctors now procured them. When one breaks down, you are running to the principal medical officer. That will be, you will have failed your role as an in-charge. You plan for some simple maintenance of this equipment so that we use them all year round. They should not be just taken there and kept in the store when people want to use them. And no, we shall take keen interest. For me, at the end of the year, it is mandatory that the inventory in each of these facilities is looked into, and we shall be interested to see the functionality, whether you have been putting them to use or not. If you're not putting them to use, then that is another issue altogether.
The resident city commissioner, Akelo Ali Sopio, has cautioned the health workers to avoid theft or face prosecution and the long arm of the law.
I'm just adding my voice to thank the city leadership for procuring the equipment. I also want to add my voice to say that they are coming at a time when those who are best paid are the ones misbehaving, stealing the equipment, stealing drugs. It is appalling that women are the ones stealing drugs. I think it is now 3 meetings that I have told women, don't soil your hands with theft. When you are in jail, your children suffer. So women, and I've seen most of the in-charges of our city health facilities are women. Please talk to your fellow women. Let women not get involved into stealing. This should be a warning that my office is not going to sit. Anybody who is caught with even one Panadol, we are going to prosecute up to the end. For me, my work will begin from police up to court. I'm going to follow up. No sympathy, whether you are a woman, a man, no. We are going to follow up. We'll make sure you face the long arm of the law.
The procurement of these assortments of medical equipment are set to be distributed to the different beneficiary health facilities in Arua City. Reporting for West Nile Television, Okumuringa Christine, Nilecast.